Hi, welcome to the Between Femmes podcast. We're Michaela,
Jane,
Ugne,
and Coco, and we're yapping about what it's like to live with endometriosis.
No medical advice, just real experiences.
Let's get into it.
So, how's everybody doing?
Good. How are you?
Hi. Also good. How's the heat?
Don't get me started. No.
Well, won't do that then.
No.
I just popped my phone into the freezer to cool it down.
Yeah, I think Jane is having the worst of it right now.
Yeah, but I mean, Spain will be like this for the next 4 months. But that's normal. It doesn't drop.
Yeah. So for today, I think it would be a really nice idea to help other endo warriors out when it comes to sharing with their friends and family what it is that they're going through. Because I know that when I got my diagnosis, that's something that was really difficult to do. And I'll share my story in that later on. But I think it would be nice for them to be able to say, like, listen to these girlies talk about it and hear their experience. And maybe that will help them in their journey as well.
I love it. I think that's a great place to start.
Okay. So the question is, like, when you were diagnosed, who did you tell first and how did you tell them?
I think, obviously, my boyfriend first. I was still in the hospital and I messaged him going, I'm not crazy. And he goes, what do you mean? Because basically, like, in the UK, when you get the surgery done, like, you go for a day unit, no one stays with you, there by yourself. It's a bit weird. So as soon as I got wheeled back to, like, my little cubicle thing, I messaged him that, and he's like, what do you mean you're not crazy? And I'm, like, still high and everything. And I was like, I'm not crazy. And he's like, what do you mean? I just kept on saying the same thing. And then I was like, no, they found it. But then I think because it was, like, such an anticipated thing, and I was like, I know I have it. It's just the sake of someone telling me that I have it. It almost felt underwhelming. If that makes sense. And I think once I started going through the whole recovery, that's when I was a bit, like, more coming to terms with the whole thing. But, like, the first few days, I was like, yeah, okay, cool, I got it. Now what?
Yeah.
But I think I found it. Yeah, go ahead.
No, I wanted to say is that something I realize now by what you're telling is that I think we might have all been diagnosed in different ways because I didn't have surgery. So I think that's maybe good to mention just so that, because that's going to be different for everybody as well. So you had laparoscopic surgery and then you were diagnosed. Yeah. Okay. Yeah.
So that's, like, the main way I think that they do it here in the UK to, like, confirm the diagnosis. I know that some people have been diagnosed, like, via MRIs, but, like, we all know that, like, the scans often don't show the full thing. So I think what they do here, even sometimes they do a diagnostic laparoscopy without the treatment. So they'll just have a look, confirm you got it, go out, not remove anything. I've had the one that was plus the treatment, so they'll also, like, remove some bits during that time. What about you girls? How did you have yours diagnosed?
I always knew that I had it, but I also had, like, PCOS, or what do we call it now? PMOS, and everything else. Like you said, I was so relieved because I was like, I'm not crazy. Like, I didn't care about the diagnosis. I knew I was ill. I was in pain all the time, and I was like, I'm not crazy. I'm not making up all this pain. I'm not a hypochondriac. I'm not anything. I'm not crazy. Wow. And that was just like a breath of fresh air, to be honest. So mine was originally diagnosed via MRI because you could see that my bowel was attached to the uterus. So they were like, oh, we think so. It looks like it. The endo specialist was like, yes, it's in line with endometriosis, but we'll do a surgery regardless. And then obviously it was re-diagnosed during surgery. Yeah. Or confirmation diagnosis. Yeah. But
how did it go afterwards? Did someone go with you, or who did you tell about your situation?
Oh, I told everyone. I was like, but I already knew that I had it. It wasn't something that was like a surprise to me. Yeah. So it wasn't like, oh, you are now diagnosed. Like a friend of mine who went into emergency surgery recently that I was telling you about, and they cut her open. She's covered in endometriosis. That was a surprise, whereas I've had years and years of symptoms And I knew it already. So the diagnosis wasn't a surprise for me, nothing. And I really was kind of telling people, look, I have hormone problems. I was saying, I have this, I have PCOS, I've got blah, 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 blah. And then endometriosis to everyone was just like, well, what is that? Okay, hormone problems. People don't understand the severity of it unless they have endometriosis, and then they're like, oh, we get it.
Yeah.
Otherwise, they're just like, okay, hypochondriac. Okay, oh, another hormone problem. Hormone problem.
Yeah.
Too much estrogen. She's got too much estrogen. She's fine though, just a bit much estrogen.
And what about you, Coco?
Mine was diagnosed with laparoscopic surgery, and I also got excision. I'm not the first person in my family to have endo, so I wasn't like the trailblazer, you know. My experience though was really, really different. And so I think that also is like my experience of gaslighting myself to be like, well, it's not like that, so maybe it is in my head, or maybe I'm not maybe I'm not being accurate with it. I had been diagnosed with PCOS or PMS, pissing me off, shit, before that. And so I thought a lot of the things were attributed to that. And I also had gotten an ultrasound to rule out endometriosis in 2018. And it came back like, oh no, it's all normal, but wow, your like ovaries are really cysty. And there's free fluid. So that must be your PCOS. But yeah, the endo thing, I think it was my sister brought me to the surgery. I think she actually told me because I like woke up in recovery and she was like, they found endo. And I was like, whoa, crazy. Can you fill everybody in? And she's like, yeah, for sure. So she was like my little health secretary and just kind of like updating everybody. And other than that, like I had literally just started hanging out with my partner when I went in for surgery. And so my sister texted him, confirmed what we had kind of already like suspected. But yeah, I think it was a bit weird in the surgery experience, because after the like gyno surgeon came back out and was like, don't worry, it was just a small amount. And so it was kind of like that, like, oh, okay. So like what does that mean in terms of what I should be feeling, how my recovery is gonna go, like, are we celebrating this? This is really weird. So it's just kind of like, okay.
But you know, you have women with stage 4 endo that have no pain.
Literally.
Do you know what I
That's
mean? And it's
Yeah.
like, okay, you can't say, oh, that was just a little amount. You'll be
Yeah.
fine, you know.
Yeah.
100%.
You did
And
great
like,
during the surgery.
yeah, and my pain got so much worse after the surgery too. But it still wasn't a possibility to be discussed at that time. Like maybe the surgeon didn't get it all. Maybe there's other things like adenomyosis at play. Like it was just kind of like oh, well, that should have worked for you, so why didn't it? But yeah, so a little bit of a weird journey. And it'll be like 4 years this December. So 3.5 years now since the surgery.
But at least now the doctors are more aware that it is not a cure. It's not going to end the pain. They know straight away, like, okay, a few months later, you may be in pain again. This is, you know, so before it was kind of like, oh, you had surgery. You should be fine now. How are you feeling?
Yeah.
And it's like, well, I'm in more pain than before. This is awful.
And they're like, okay, we'll try
like
this.
a few weeks later.
Yeah.
And he was like, you know, no problem. And I was like, really? No problem? This is not normal.
I would say probably for the 6 weeks following my surgery, my pain was like the same as it was before the surgery. So I was just kind of like, okay. And then I don't know what happened week 6. So it's just like crashed and burned, and like everything got so much worse. And I was like, oh my God, I didn't know that was a possibility.
Scarring,
yeah, 100%. And then I found out this year too that the surgeon didn't take pictures, didn't name the staging on the report or anything like that. So, and retired in June. So like never really know.
In Switzerland, you don't have stages. They don't say it's stage 1, 2, 3, or 4. It's like,
interesting.
Yeah, it's just severe, extreme, or just endometriosis. So when I asked him afterwards, I was like, what is severe endometriosis? They use stages. He was like, oh no, it's stage 4, yes.
Okay.
But we don't use that terminology. And
yeah, I think that was maybe what she was saying with like, oh, just a small amount, like just mild endometriosis. And I was like, interesting. Okay.
What about you, Mick?
Yeah, so for me, it was through an MRI, but I'd been had multiple ultrasounds and everything. And every time I had an ultrasound, they could never find my left ovary. And they would always say, like, we're seeing something, but we don't know what it is. And like I said, my hormones have been a shit show like most of my life since I got my period, basically. And so I also have PMOS that was confirmed a bit earlier, and I have a thyroid condition. But the MRI, because I think they, like, for me, it's stage 4, but I think they also call it deep infiltrating
Right.
Be
endometriosis.
infiltrated, exactly.
Yeah. And so I have that, so they could definitely see it on the MRI because like with you, Jane, my bowel was completely is like you can totally tell that it's connected, that there's a lot of like how do you say that when it's stuck together? The tissue.
Adhesions.
Yeah. And also like my uterus is completely stuck to my bowel, so they could totally see it. So that was my diagnosis, but I had never heard of endometriosis before my diagnosis. And I don't nobody around me had ever mentioned that either. So for me, it was really out of the blue. And the doctor also did it in a way that was kind of like either he thought I should know what it is or he didn't care to explain it. Like it was very like, okay, so you have stage 4 endometriosis. We're going to go with subscribing you birth control as treatment, given the fact that your bowel's involved. So like I think I've said it in a pod before, like in the Netherlands, they're a little cautious on surgery just because they know, one, it grows back. So there isn't like, it's not considered such a golden standard here. They really want to check the situation before they let anybody have surgery. And because they knew with me the risks of my bowel, like for leakage and problems and stuff later on. So he was really like, don't have surgery unless you really feel you have to. Like there's no other option. And he says he refers to pain, but I'm like thinking if I hear your stories, I'm like thinking, yeah, but pain doesn't get better with surgery. So when do I go for surgery? You know?
Yeah.
So for me, it was really like I had no idea what it was. I got this diagnosis, and indeed, my partner Matthew was the first one. I was driving home, and I was on the phone with him, and I was not understanding what the hell this was. And I think I told my mom, but I don't think I told her. My thing is that I don't know what it is. Somehow I felt like a little bit of shame. I felt like this diagnosis, there was something maybe I did wrong, or I don't know, something caused this that I should have done differently because I didn't understand what it was. And only like a year later did I did so much research after I was diagnosed that I started to understand like this isn't me. This is like this has been going on in my life since I was probably 13. And then I started to like be mind blown by what the fuck this is. And but still I didn't share it with a lot of people because I didn't talk about it a lot because I don't know. I don't know why there was like a shame. There was some sort of like not feeling comfortable about it. And so I didn't talk about it a lot. And I think that's where I went wrong because I only started talking about it last year with people. And now like certain people, my parents are like almost like concerned because why is she suddenly so much pain? But actually I've been in pain for years. I just didn't talk about it. So that's a little bit of how my journey was. So I haven't had surgery and it's still on the table. I just don't know if I should do it.
And it's hard to know, yeah, like you said, like when is that time of like, is this too much pain? Is this too much organ involvement? Like, what are the other risks? Because I like didn't really feel like I did my due diligence and like researching and really discussing like what is the worst case scenario here? Like what is the rare outcome? And it was kind of just a quick look of like, oh yeah, it is possible your pain will get worse, but it's super, super rare. And I'm starting to realize like with the birth controls that I've been on, with the like treatments I've had, I will always fall into the rare category. Like this doesn't happen to most people, but there is a small chance, and like legally we have to say this, and I tend to fall into that category too. But it's the shame piece is so interesting, and I wonder if part of that too is like if this was like a muscle issue we were dealing with in our legs, would it be easier to talk about? Is there this like inherent like feeling of shame that shouldn't be there but is because it's like a woman's problem and like it's
And
not
it's so
something to be
not
discussed.
understood.
Yeah,
I think completely. Yeah.
like there's like a lot of
That's
stigma
exactly
around it still
I think when you
about
have like, it's really wrong to say, but when you're diagnosed with cancer, it's like people, I don't know, see it very differently because they
yeah,
understand cancer, you know? And I'm not
yeah,
saying endo is cancer, but I'm saying like, I think that's why there's a shame was for me because I didn't understand this disease and it's so women related and it's almost like taboo-ish. It was like, don't
yeah.
talk, like now they're talking about it more. So it feels more comfortable,
Mm.
but it wasn't, you know?
Even
It's not
back,
because it's hormonal and it's not life threatening. Do you know what I mean? So automatically we're like, Well, what do I really say? Exactly. I don't have
Well, it's not
cancer.
life-threatening, but it kind of is.
Can
Like
be,
when it
yeah.
attacks your
Yeah, but I mean,
organs.
you don't have a diagnosis where do you know what I'm saying? It's not like
Yeah.
an
Yeah.
aggressive cancer that you've
No,
got 3
it's a
months to
life
live,
sentence, basically.
and then when you're trying
Yeah.
to explain to somebody and they're like, what is it? And you have to be like, well, is it caused by hormones? You know what I mean? And then it's kind of dismissed and it's embarrassing. It's not embarrassing. So that's not really the
I
word
get
I'm
it. I get
looking
what you're
for.
feeling.
Yeah. Yeah.
Yeah.
And also
Yeah.
for doctors to
And
be
then you're
like,
just
we
like,
don't really know.
dismissed by people. And you're like, okay, cool. Okay, you won't understand. All right, fair enough. You don't understand. But actually, it's a huge problem. I'm in pain all the time.
Yeah.
I can't have a proper sex life. I can't have a normal working career every day because I'm in pain. Like, what?
Yeah,
I think it's
100%.
pretty serious.
Yeah.
I
Yeah,
think
for sure.
I always like struggle in a way, like when it started getting bad, I always struggled and I was like, oh my God, I got such bad pains. I didn't understand it. That was way before diagnosis though. And then after the diagnosis, I got so tired of explaining to people like, oh, sorry, I can't make it tonight or whatever, and just went, you know what? This is happening. And I've been so open about it that probably some of like my boyfriends, not boyfriends, but men friends, they're probably like, I don't want to hear about your uterus anymore. And I'm just like, this is happening and it hurts.
You need to.
Because like I'm forcing you to know. And I think
And
it's like,
statistically, you're not the only one they know with it too, right? Like,
but like I had some friends because like I speak to him, like really good friends, and I speak to him, and he was like, you know what? Actually, one of our friends from this other group mentioned it, and I was like, I didn't realize what it was, and then I remembered you talking about it, and he was like, oh, actually, I know about this, and I was just like, I've done some good in the world. I'm like, someone a little bit, do you know what I mean? But I think it is like when you are constantly in that pain, and you're like, oh, I'm unwell again. Oh, I'm unwell again. Oh, what's happened today? Oh, I'm unwell again. It becomes that whole thing where you just don't want to talk about it anymore because that's like the more you talk about it, the more it takes over your life in a way.
yeah.
But then I think it's so important to talk about it. I mean, that's what
because it impacts our life. Like, you don't want to let it take it over, but it does. And I get what you're saying about like also not wanting to feel like a burden to people. So I indeed, the first year I would never tell anybody when I was having the worst flares, like miserable, and like even depressive because you're finally starting to realize what the hell you have and what this means for your life. And I was getting depressed by it. And I was on birth control, which was not working well. So I ended up even getting suicidal, which I knew was the medicine and not me.
Yeah.
But even then, I wouldn't share that with anybody. Okay, my partner, because he's next to me and he's experiencing it with me, and he would be concerned. But I didn't tell anybody, not my parents or anything, because I think that it's a burden, but also maybe it's me. I wanted to understand what the hell this is and what I'm going through before I can tell anybody. It needs to make sense to me before I can talk about it.
That's
And what's so sad is the doctors couldn't even tell us.
Exactly.
Yeah.
You know what I mean? You've got someone there. I needed to understand what I was going through. I had no idea. You were just diagnosed by a medical professional and there was not enough information given. You know?
I've
It's
had
really,
so
really
many.
unfair and it's sad.
Yeah.
It's
I've
like
had so many doctors just be like, we don't know because it's women's health, and be like, is that the answer that we're accepting? Like that's what we're
clearly
okay
we
with.
are.
But then also if I share my experience and I get that no, that's not typically what that looks like. It's like, what does typical even look like if we don't have studies and we don't have like long-term data about what is even, they were like, yeah, we don't know what causes it. We don't know what makes it worse. And it's like, hey, then don't tell me that what I'm going through isn't that if you don't have like the body of research to refer to.
Yeah. So
it's
maybe
really,
maybe we can share a little bit like some of us had surgery, but what are we doing right now treatment wise might help as well to kind of know our current situations. Like treatment wise, if you're doing anything, like if you're taking anything or
treatment.
Yeah. Just so to share like our current situations.
it's bad. What's the current situation? It's dark. There's too many clouds and storms around me. So I was like, we've had a chat about this in a previous pod, but like I went through the whole thing of like after the surgery, 8 months after, I think I had to follow up. That went nowhere. It's like going medical menopause, stuff like that. I'm like, well, that can't be the only option. And I started looking at more things, and then obviously I had the coil fitted during surgery, and for me, that's not been working. So I went back to my GP and I was like, no medical menopause. I don't know what to do. I want this coil out. Everything's shit. It's ruined my life. I don't want this anymore. I'm like, I'm 31 years old. Like, why the fuck am I going through this? So we are currently trialing a double contraception to see if the coil would settle before I rip it out. It's been 8 weeks. I want it to end. It's so bad. Imagine being in like because I got PMDD most likely anyway, but imagine like luteal phase at all times for 8 weeks straight, and then you got the flare-ups for some reason that the pill on top of the coil has made the flare-ups a lot more frequent, and then you're always inflamed. Why?
Yeah.
Yeah. So we're trialing that. I know it's not a treatment. I know it might help my coil settle. Maybe it won't. I don't know. That's what
But they place the coal because they, like I've heard more often, they do that because after your surgery, they think it suppresses growth.
So that I think.
Allegedly.
That's what I mean.
Like the coil sometimes, I know for some women that it stopped periods completely. So obviously if you don't have your periods, you kind of get rid of that worst part of the endo. You still get your flare-ups, but you won't get it as bad. Then, you know, there's the whole thing of like, Marina will fix your life. Praise baby Jesus. That's not a thing. Like it works for everyone so different, right? So I like when I initially got offered to get that inserted during surgery, I was really reluctant because I was like, I don't want stuff in me. Mm-hmm. And then I spoke more and more to Luke about it, and he was like, just try. Worst scenario, we'll just rip it out. So it's nearly a year. Oh yeah, I'd get him to like get like a little headlight on and just be like, get the pliers, get rid. But like it's been nearly a year. I still don't know where I'm at with it. Obviously, a week left on the devil pill, and then we'll see where we're at. But you get told so many different things. For some people, it makes it worse. For some people, it makes it better. And it's like you can give someone advice from your personal experience, but then you never know what's going to happen.
Mm-hmm.
So,
yeah. What about you, Coco?
I've given up.
As has Jane, right?
Yeah. I'm channeling my Jane. I think so. I went off the Slind a month ago, and that was hormonal treatment number 10, I think, that I've tried over the last 18 years. All the typical shit that it should be doing. Like, yes, it'll stop my period, but my chronic pain will be worse. My flare-ups will be worse. My energy will be worse. My inflammation, my skin, my fatigue, like all the other things will be so much worse, that it just wasn't worth it to me. And like, I even had a nurse be like, yeah, but you're not getting your period. And I was like, yeah, but the pain that I'm getting on the daily from trying to walk up the stairs is akin to getting a period. So yes, I'm not hemorrhaging through my favorite clothes, which is amazing, but I'm still getting all the other things plus a worse mood. Like, are we celebrating this? That's super fucking weird. Okay. The Mirena for me was not a good fit. I got it taken out 3 years early, had it in for 2 years, like major weight gain, major mood impacts, like way worse pain, which we like put in place to be like, okay, we'll stop your periods to resolve your pain, which is also my fucking beef, is like stopping your periods does not resolve your pain. We need to get past this idea that that's happening. I think I was experiencing hormone resistance because every time I've been on a progestin only birth control, all my imaging shows my lining thickening, even if I'm not bleeding. And I get like way worse pain flare-ups, way worse like body impacts, like hips, back, all the things. And like the mood stuff is so bad. But usually the solution for that is like, okay, we'll stay on it because it's stopping your periods. And here's a prescription for your skin, and here's one for an antidepressant, and here's one for an anti-anxiety. But I swear to God, like 10 days after I came off of this Lind, I feel like the black cloud on my brain just like lifted. Because similar to you, Mick, I was like, this call is not coming from, like, I've struggled with anxiety and depression, and like that's part of my ADHD for sure, but the chemical feeling of it, of like the call is not coming from inside the house, like this is not my thoughts, like these are scary dark thoughts. And like similar to you, Ugne, like experienced PMDD as well, which was also a big like worry of mine coming off of the pill and getting periods again, because that dip is just so extreme. And like I feel like that's a really understudied gap that they're gonna come up with some really interesting information. But I was also just sort of given the choice of like, okay, well, you had surgery. We could go in for another surgery, but like your experience was really bad the first time. So we're kind of reluctant to do that. You've tried all the hormonal treatment. So I'm kind of left with the Sophie's choice now of like, do you want to do chemical menopause? Which I was like, no more hormones. Like, no, thank you. Do we go in for another exploratory surgery, which could be really 50-50, could give us more information, but could make you worse, or do we just go for a hysterectomy? And with like some other health stuff that we're looking at right now, like the risks of hysterectomy or the risk that hysterectomy brings with like all the other stuff, I'm just like, not great options. Or do we just like keep raw dogging life and just see?
It's just so sad that all of these hormone treatments are being prescribed to us constantly and we're not getting results. You know, maybe one works a little bit and then
I was like, is it possible that
with
it's
side
making it
effects are
worse?
just so severe.
Yeah.
Like this cannot be, like, imagine your teenage son was prescribed all of this, and then your son in his 20s, and oh, now he can't ejaculate. Oh, now he can't have babies. Oh, now he was on this hormone. Look how much weight he's put on. It wouldn't happen.
No.
Yeah.
Now
I just
they
like,
made it so socially acceptable
yeah,
that we can just
100%.
pump people with hormones. And
Women.
Yeah.
I'm similar to Chloe. I've had multiple medications that were meant to put the coil in during surgery. They forgot for some reason, or they didn't do it for whatever reason. It was meant to go in. It wasn't there afterwards. Then they put me on hormonal medication, but I bleed through. Most hormonal medication induces a period instead of stopping it. So obviously it makes everything 10 times worse. I've tried so many pills that it just doesn't work. And then they were like, all right, time for medical menopause. But he was very into, I think, private hospital as well, because he had like it advertised in his office. And I was like, what the fuck? I'm 35 years old.
Yeah.
How do you want to induce? And also the consequences of that. Do you know how unhappy 60 or 50, 45-year-old 50 women, they go through such shit when they go through menopause? So yes, it might stop the pain, and then the rest of me is fucked. I'll be like some old decrepit woman that's just dying.
And it's just like, what's the risks? What's the most
And
rare
it's so
outcome that you just
yeah.
don't come out of it and now you're just in menopause? Like, what? That's not a great option.
No.
Don't want that.
No.
Meg, are you trying anything, or you're giving up as the most of us?
I think I'm reaching that phase of giving up because I've done like tried 4 different birth controls, and I'm on one now that it's such a mind fuck because
What are you on now? Sorry.
I'm on Zuli. I don't know if that's international. So it's a mix, and
Okay.
it's basically, yes, it's completely killed my menstruation. I don't bleed anymore, which was one of my biggest problems, right? Heavy bleeding and prolonged bleeding. And also my lower back pain was because it was connected to my period. It's helped that also a bit, as in I still get lower back pains, but it's usually shorter and it's not as bad. Like I can get out of bed. When I was on before, I couldn't get out of bed. So those things had stopped. And I'm like, okay, those were big things. But I'm like, I don't feel like myself anymore. I'm continuously gaining weight. I have fluid retention as crazy. Like I can't even wear my rings anymore. I feel like my face is completely swollen like a balloon the whole time. And I don't feel like me. And also it's killed my libido. And I know it sounds stupid because you're making a choice between libido and pain. But I'm like thinking that's part of, like, I love sex. I've always loved sex. And I have a high libido, and my libido is like flatlined.
Yeah.
And yeah, I miss it. And I'm kind of like, what do I choose? Like, if I don't think I'm going to get very old. So then I'm like thinking I'd rather than maybe not take birth control, maybe enjoy sex. I have no idea if I will, because if I have sex now, it hurts. But I miss the pleasure of it. And I'm like hoping that maybe the pill has made it worse. And that if I stop taking the pill, because before the pill, it wasn't as bad. I feel sometimes that the pill has made certain things worse for me. Like I didn't have as much pain in my body, like daily. Like I have weird hip pains. I have weird back pains. I have shoulder pains. I have knee pains. I suddenly will get a flare in my knee. And I never had that before the pill. And I'm like thinking, is the pill causing this or not?
Possible. Very, very possible.
I'm
At least for mine was what, 1,000 times worse.
So I'm thinking of like, I'm on the verge of making the choice now, end of this month, to just stop and see. Like at least go 2-3 months to see what it does to me. And then make a decision afterwards. I can always go back, you know?
Yeah, 100%. That's where I'm at right now. To be like, what is my body's baseline? I don't even know. Like we've been going through so much trial and error for the last 18 years that I was like, I don't even know my body anymore. I don't know what she's able to do by herself. I don't know any of it, but I will say like post coming off of the pill, having sex again, holy moly, the difference of the flare-ups on the pill versus not on the pill just from sex, mind blowing, like day and night difference. And I really do think that's something that's like, it's a tiny little print that ants can read in the pamphlet about the possibilities of worsening pain and all this stuff from these side effects, but it's not discussed enough to be like, this is a red flag. Like if you're experiencing this needs to be addressed urgently, because unfortunately you can have like hormone resistance, which like in my case, I suspect progestin resistance driving estrogen like crazy, progress my adenomyosis, because the difference in scans from 2023 to 2026 is like a massive progression of adeno. And I was on pills the whole time that was meant to suppress it.
Yeah, exactly.
But I think like when we add in those other things like PCOS and adeno and endo all into it, they're still not looking at it as a whole body picture. They're just being like, oh, but you're not getting your periods. That's great. Like, check. It's doing its job.
Yeah.
It has to be better. There needs to be better options than that.
Yeah.
Just so awful. I was looking, sorry, I know this is time the pods can hear it. I looked so sad when I was listening to Michaela's story, and I really felt her pain. I was like, that's my pain too. And then I looked and I was like this.
I was trying not to cry.
Jane, get your face right, girl. Like people are gonna see this.
It's real. That's so real. And it's like
real, but I didn't, you know, when you just listen to it, and I was like, if you will see it in the thing, and I'm like,
bless you.
Ladies, thank you so much for a great discussion. I'd like to continue this over part 2 so we can talk more in depth around how it affects us personally, the burnout of constantly having to explain ourselves to friends, colleagues, employers, and people around us. So thank you so much. Great chat. And we'll see you for part 2.
Yes. Bye.
I only have one hand because I have tea, but imagine a hand.